Hello and welcome to Dr. Joy's Mammographia. I am Dr. Ajith Joy, and today, on the eve of World International Women's Day, I would like to wish all the women a very happy Women's Day. How is it important and what is it important today to our company connected with Women's Day? This year, 2023, is a landmark year for the Doctors Diagnostic Center group of laboratories. It completes 40 years since its beginning in 1983. And also, the DDNMRC group, that is Doctors Diagnostic Nuclear Medicine Centers, completes 20 years, and this is the 20th anniversary year of DDNMRC. As part of our anniversary celebrations, this year we are launching our next flagship company and brand, Dr.JOY'S Mamografia. The sole purpose of this company is to offer a breast cancer screening program which will last for 10 years. Women are always the backbone of society. A family can be your mother, can be your sister, can be your daughter, can be your wife. And this Women's Day, I would actually call upon the men, because women are normally not the decision makers in 60 to 70% of our families in our Indian culture. They rely on men to take these decisions. Of course, Kerala is very educated and there are many independent women who are taking their decisions and progressing in that path. Definitely that's thumbs up. Every woman should look at investing in their health. And this is one model where they invest in preventing the largest or the most common malignancy which is known to affect them. So if you look at that statistics, 1 in 8 women have a lifetime risk of attaining breast cancer in our country. There's another alarming statistics. When the last parliamentary questionnaire in 2022, when this question was asked, what is the incidence rate? I think it was debated in the parliament, which India Today group had published. There it showed when 31.3% per lakh women is the incidence across India. In Kerala, 45.7 per lakh of women is the incidence of breast cancer in Kerala. That means, which is the highest in the country. There's also another thing. In the last 25 years, if you look at the 20 to 30 years and the 30 to 40 year window, the breast cancer incidence has doubled. Means 2 has become 4 per lakh population, and which was 7 in the 30 to 40 per lakh population has become 16. Whereas beyond 50s, it is showing a slight dropping trend, which is also alarming. And if you look at the younger age group cancers in breast cancer, see, when a patient, a layman looks at breast cancer, it is just one disease. But a treating doctor, it may be 6 or 7 major different subtypes, and if you go divide it into its genetic distributions, that's all so many subclasses. Some are very aggressive. But whatever you say, you can look at it as 5%, which is very aggressive. This is exactly why I said in early diagnosis, 95% of all these breast cancers can be brought into a curative stage. At least they wouldn't have to die of this disease. This is a balance of their family, their socio-economic status, and in society, when it comes to a larger scale, it is less of a cost burden to psychological, mental balance of society. So it's very important. When something is known to cause so many deaths by one single disease, we need to do something about it. And if you look at insurances, there is no provision, that is very less that is provided for screening procedures. You have to get admitted in a hospital and things like that. So this is where, when we thought there is a requirement for such a screening program, that's why we had coined this all-encompassing, comprehensive, diagnostic grade 3D tomo mammography, plus an ultrasound with elastography and an MRI included for patients who are having any signs and symptoms of that, if required. That is based on the doctor's recommendation after they do both of these. And if required, a PET-CT is also included into that. So all on a one single cost, which lasts for 10 years. So they can do 10 such procedures, screening program once a year for 10 years. Definitely, we would pick up much more number of cancers if it were to occur in that population much early, and it can be curative. This Women's Day, so it is really good to think of a gift of health, a gift of love to your loved ones, be it your mother, your sister, your daughter, or your wife. So I would call upon the male members of the family and the society to look at this, to gift something that can save life or make a meaningful change in their lives and contribute towards early detection. We've been talking about early detection time and again, but there was never a program like this. And this is a very unique program. To our knowledge, this is one of its kind, launched for the first time in the world. So make use of it. There are just 60,000 membership spaces available. And as you know, 3.5 crore is our population. Probably, 1.5 crore would be the women's strength, half of that. So approximately 80 to 90 lakh Indian Kerala women are eligible for this. We start with one center. Per center, we are looking at accommodating 60,000 members. Even if we put up 10 centers together, we wouldn't be able to cross 6 lakhs. So we are aiming by the end of this year to launch 10 centers across the districts of Kerala. And I would, ask you all to look seriously to invest in your health and enter such a program where, you clearly take care of early detection as the focus for breast cancer screening. For knowing how to join, please follow the links after this video. There we've given the website, the phone numbers to call, join our Instagram page and Facebook pages, and talk to your friends and family, whoever would like to and want to know more about it. Please give us a call. We believe this is the best gift that you can give your loved ones. So on the World International Women's Day, once again, wishing you a happy Women's Day.